We are Group 15, and today we're presenting GOSECC, a data product designed to support SECC's transport service operations. SECC is a community-based organization in Sydney's southeastern suburbs that provides transport and support services for older adults, people with disabilities, and culturally diverse communities. Through our research, we found that their current booking process is still highly fragmented and manual. Staff often rely on multiple channels, manual data entry, and disconnected communication, which creates inefficiency and coordination problems. After interviewing SECC staff, we refined our problem statement. We found that the current workflow depends heavily on phone calls, spreadsheets, and manual input into AlayaCare. This leads to duplicated data, time-consuming administration, and fragmented coordination across systems. Compared with our earlier checkpoint, the problem became much more specific. Instead of focusing on general booking inefficiency, we narrowed it down to system fragmentation, manual duplication, and the core workflows that staff actually use every day. Based on this, our updated hypothesis is that if SECC adopts a more centralized system for booking, trip, and client management, it can reduce manual data entry across fragmented workflows, minimize duplication, improve data accuracy, and give staff clearer real-time visibility of daily transport operations. To evaluate this idea, we defined both quantitative and qualitative measures. Quantitatively, we expect booking time, data duplication, reporting time, and trip scheduling time to decrease. Qualitatively, we expect staff satisfaction, confidence in data accuracy, ease of use, and dashboard clarity to improve. This table shows how we translated our hypothesis into 3 core feature areas: booking management, trip management, and client management, each with clear expected outcomes and measurable indicators. This also shows how our hypothesis evolved. Earlier, it was based on assumptions and broader feature ideas, but after staff interviews, we focused on real workflows and removed features that were already supported by existing systems. To better define the target users, we focused on 2 key staff roles: frontline staff who handle bookings and daily coordination, and transport team leads who need a broader view of operations, staffing, and service reliability. To ground our design in real practice, we conducted a field study with SECC. This included a contextual interview with Irene Travato, SECC's assistant transport manager, as well as usability testing with 11 participants. One of the most important insights from Irene was that bookings are still mainly handled by phone, daily run sheets are managed in Google Sheets, and client and trip details then need to be manually entered into AlayaCare. This confirmed that the real problem is not a lack of tools, but fragmented tools and repeated manual work across systems. We also found that some workflows, such as incident reporting, are already supported by existing systems, so we narrowed our final scope to the areas with the highest duplication and coordination burden. We used affinity mapping to synthesize our interview and usability findings, and after refining our analysis, we identified 8 final themes. The most important themes for our design were dashboard clarity, task completion, real-time operational awareness, and how well the system fits SECC's actual workflow. From this, several findings stood out. Users found the interface professional, but the dashboard did not clearly show priorities. The booking form felt too long, some labels were confusing, and staff consistently wanted better onboarding and more real-time operational data like cancellations, delays, and trip status. We also reviewed 21 reference products. Most supported booking and scheduling well, but they often focused on back-end operations rather than staff usability, which reinforced the need for a workflow-focused system. A key insight for us was understanding the role of AlayaCare in SECC's current workflow. AlayaCare already supports care records, scheduling, and compliance, so our goal is not to replace it. However, it is not designed for transport-specific coordination, which means staff still rely on phone calls, spreadsheets, and manual re-entry with limited real-time visibility. This showed us that GOSECC should complement AlayaCare by improving transport operations and reducing workflow fragmentation. As a result, we narrowed our final design to 3 core features: individual booking management, group outings management, and client management. These were chosen because they represent the most repetitive and operationally important tasks in SECC's daily workflow. Managing your community starts with a comprehensive clients database where adding a new member is fast, allowing you to capture essential health and support data, including medical conditions and mobility risks, while securing emergency and GP contacts so that vital information is always ready and your client is set for booking. Moving to individual trips, you can effortlessly toggle between a visual timeline or a detailed list view and use the Create Booking feature to pull up client name suggestions that automatically fill in care notes and contact details, allowing you to finalize trip categories and times for a successful booking in seconds. For group outings, the system streamlines complex scheduling by allowing you to create a trip with multiple stop inputs for different destinations. Finally, by clicking into the outing detail, you can select Add Booking to quickly populate the trip manifest with suggested client profiles, finalizing the process with a single click. As next steps, we plan to continue testing and refining the prototype with SECC. Our main priorities are improving dashboard clarity, building the notification system, and strengthening real-time operational support. We will then move toward a higher fidelity prototype in the next stage.